So I'm Dr. Rita McGuire. I want to welcome everyone to our Wednesday webinar where we talk about CBD. We talk about different conditions that CBD could be helpful, could be a tool in our toolbox. And because it is October, it's Breast Cancer Awareness Month, I really wanted to bring some more attention to how we can utilize CBD for those who we love, for those that we know, for those that really could benefit for a CBD product to assist with their symptoms. And it's really, really important that you remember that when we speak about CBD, we can't make any claims, right? We're not here tonight saying that CBD will cure any breast cancer or any other condition that we speak about on Wednesday. But what we're going to specifically talk about tonight, we're going to talk about symptoms that can help maybe reduce nausea and vomiting. Maybe we can address some symptoms that those who are undergoing chemotherapy, lack of appetite, stimulating appetite. And we can also look at some of the side effects that treatments for breast cancer can leave people with hair loss. So let's talk about first cannabinoids and breast cancer. Now, when we look at breast cancer, we can't leave out other cancers. There's been a lot of research that has been shown in vitro and in vivo, meaning, in a test tube, in animal models and outside of animal models, that show that CBD can help reduce the metastasis, the growth, the proliferation of cancer cells in the breast. It also holds true for cancer in the colon. There's a lot of studies that show how CBD can actually reduce the tumor volume or the growth or the proliferation of cancer, even in the colon. We speak about brain cancer. The same thing holds true. There's a lot of studies in vivo and in vitro that demonstrate CBD really helping to reduce the proliferation, metastasis, the invasion of cancer cells in the brain, in brain cancer. And then another cancer where CBD has been studied in vivo and in vitro is prostate cancer, also showing a reduction in tumor growth and metastasis. So though this discussion tonight is about breast cancer, it's really good that you understand that the same things hold true when we speak about colon cancer, brain cancer, and prostate cancer. So again, the disclaimer, I'll be reminding you about the disclaimer that these statements made are about these products, about this information as it relates to CBD has not been evaluated by the Food and Drug Administration. The efficacy of these products that we're going to talk about at the end has not been confirmed by the FDA approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. Today, like every day, I get a lot of emails and I love getting your emails. So always, never, ever hesitate from sending me an email. But I got an email today and one of the business partners was a little frustrated because she was using our products for a loved one that has dementia. And in the email, she stated that the products are not improving this person's memory. And again, I have to caution you is that when you're sharing these products as a tool, not a cure, as a tool in the toolbox, that you do not, you don't allow anyone to assume that you are offering a cure, right? So we never said that CBD would miraculously cure her memory and her memory would come back. But what we are saying is that CBD can assist those who have dementia, give them more quality sleep, have them less irritable. So always remember the disclaimer that these products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here tonight is not meant as a substitute for or an alternative to information from your own doctor. We always recommend that if you want to use CBD, you're under a physician's care, you're on medication, please plug your physician in, let he or she know that you want to use CBD as another tool in the toolbox. And when you're consulting your healthcare professionals about potential interactions, you may be on medications like blood thinners that potentially can interact with CBD. This is a good time to do it before you start using it, then after, right? So the Federal Food, Drug, and Cosmetic Act requires that we read this notice. So let's talk about a little stats before we get into the meat of our conversation tonight about breast cancer. Breast cancer is diagnosed every 29 seconds around the world, and every 2 minutes in the US. In fact, it's estimated that 86.4% of people will survive 5 or more years after being diagnosed with breast cancer. And yes, men can also get breast cancer. So it's not just a disease for women. About 292,000 women and 2,350 men will be diagnosed with breast cancer in the US this year. So when we look at the estimated survivors of breast cancer, and October is when we're really celebrating breast cancer survivors. We're celebrating all the research that's going on. We know that there's about 2.8 million breast cancer survivors in the US. So though breast cancer is the leading cause of cancer death in women after lung cancer, it's about a 1 in 36 or 3% chance that women will die from breast cancer. Now, by race, we know that Caucasians have a higher incidence of breast cancer, followed by African Americans, then Pacific Asian and Hispanic, and then American Indian or Alaskan Native. So the incidence, yes, is higher in Caucasians, but we're seeing these numbers in African Americans really starting to exceed Caucasians. So when we look at risk factors, we cannot negate the fact that there is a link with breast cancer and digestion. Many of you have heard about colon cancer, and the reason why colon cancer has been found to be a very high incidence in African Americans is because we like to barbecue. I mean, as a culture, we love to barbecue, and we love to barbecue on those charcoal grills. And what they found with colon cancer, like breast cancer, when you barbecue and that charcoal that's on that rib tip or that sausage or that burger, right? That charcoal is something that cannot be broken down very easily in our intestinal tract. So that charcoal acts then as a potential toxic chemical or a mutagen where it starts to change the dynamics of the cells and increases colon cancer. Same holds true for breast cancer. The thought of women who don't have frequent bowel movements, or women who have incidence very high of constipation. The same thought is there that colon not eliminating frequently puts that person at risk of mutagens in the fecal matter that then is absorbed in the bloodstream and then makes its way to the breast tissue. So it's really important that if you suffer from constipation, if you're not having frequent bowel movements, that you increase your fiber in your diet, you start to incorporate a plant-based diet so that you're able to move those potential toxins out of your colon. Vitamin D deficiency and obesity is another risk factor for breast cancer, right? That's why we really, really promote that you continue to work on your weight. If you're overweight, to start to embrace a healthy, active lifestyle, a lifestyle that's not full of fad diets, but is a diet that is incorporating less processed food, less fried food, less red meats, and really plant-based sort of diet, fruits and vegetables. Vitamin D deficiency has also been linked to breast cancer. So making sure that you are checking in with your healthcare provider and knowing what your vitamin D level is. If your vitamin D level is low, it's important to replace it. In fact, they found that women who have higher levels of vitamin D have a 50% lower death rate from cancer than those who had low levels of vitamin D. So vitamin D deficiency not only is linked to breast cancer, but so many other cancers, as well as obesity. There's also some links with antiperspirants and deodorants. There's many deodorants that have aluminum-based compounds in their active ingredient. This has been found in research to cause the sweat ducts or glands underneath the armpit not to flow, and to suggest that this exposure to aluminum can cause or have an estrogen-like effect. Estrogen in high levels, again, is linked with breast cancer. The same holds true with parabens. Now, parabens and other preservatives can also be found in some deodorants and antiperspirants. And again, there is some evidence that suggests that parabens, preservatives, aluminum, all of these chemicals can mimic estrogen. And again, high levels of estrogen put you at increased risk of breast cancer. So let's talk about some of the symptoms of breast cancer and the treatment, because these symptoms are pretty much linked to the symptoms that you may have when you're undergoing chemotherapy or you're undergoing radiation. Those symptoms are nausea and vomiting. Many times there's pain. You know, if the cancer has spread to the bone, it can cause pain, as well as sometimes there is spread in different lymph glands in the brain or in the breast tissue that can cause pain. There's fatigue, there's anxiety, there's lymphedema. Lymphedema is a really horrible side effect that occurs typically after a woman or a man has had pretty extensive breast cancer surgery, mastectomy, lymphadenectomy, where they're going in the lymph glands and nodes, they're removing them, they're doing biopsies. When that happens, it leaves men and women with something called lymphadenopathy. Lymphadenopathy is when they're getting a lot of swelling in the arm. The arm is swollen because those lymph glands that typically are there to drain the fluid is no longer there. So lymphatic drainage massage is often recommended along with a lymph sleeve to keep the compression in the arm so that that swelling is not there. So let's move on to really understanding CBD. Where does it come from? How does it work in the body? Because when we start talking about products, you'll understand why these products should be recommended as a tool, as a holistic option for those who are undergoing treatments for breast cancer. So let's first look at the cannabis plant. The cannabis plant has two species. One species is marijuana. That's the species that gives you the high, the euphoria, the paranoia, the munchies, because it has high levels of delta-9 THC. There's another species that the cannabis plant also produces, and it's called hemp. Hemp is the part of the plant that has very low amounts of delta-9 THC and it has high levels of CBD. So hemp is described as the species that gives you the health without the high, and the marijuana species is that species that gives you the high. And again, it's just in the difference in the amount of delta-9 THC that makes these species different. Marijuana has high delta-9 and hemp has very low delta-9. In fact, by definition, hemp is defined as containing 0.3% or less of delta-9 THC. So let's look at CBD. CBD is an abbreviation for cannabidiol, and CBD is the #1 compound that the hemp plant makes. In fact, CBD has a long list of medicinal properties. We talked about the fact that when someone has breast cancer, it may cause pain. It may cause pain because it has starting to spread to maybe the bones or very close proximity tissue, which is the breast. CBD has been shown to be a very powerful analgesic. It will reduce pain by the fact that it reduces inflammation. When the breast has cancer in it, there's a lot of inflammation, there's a lot of compression, there is a lot of conditions that are causing this inflammation and pain that CBD can address. It also has been found to cause vasorelaxing of blood vessels so that blood flow can be easy in the breast. CBD can reduce the constriction of vessels. So CBD is not only a great analgesic, it reduces inflammation, but it's also a vasorelaxant. CBD also reduces nausea and vomiting. And that is one of the #1 symptoms that one who is receiving chemotherapy and even radiation will have, and that's nausea and vomiting. It also relieves anxiety. Just getting the diagnosis of having breast cancer can produce a lot of anxiety. It can produce depression. It can even cause a lot of sleepless nights. And CBD is able to, and we'll talk about how it does that, it will be able to come in and help to release more serotonin and more dopamine. Those neurotransmitters that the brain produces helps your mood, it helps your sleep, it reduces anxiety and depression. So just know that CBD does have many, many more medicinal benefits, but those are the main ones when we are talking about breast cancer and breast cancer treatment: reducing nausea and vomiting, reducing inflammation, reducing anxiety and depression, improving sleep, and also being a vasorelaxant. Well, there's other compounds that the hemp species makes, and those are other cannabinoids that also have medicinal properties. CBD, also CBC, CBG, CBN, delta-8 THC, Delta 9 THC, all of these compounds are what we call cannabinoids. In fact, the cannabis plant makes over 140 cannabinoids, also can contribute to benefiting those who have breast cancer. So for instance, CBC will inhibit cancer cell growth. It reduces inflammation. Also, Delta 8 THC will help relieve pain. CBG aids in sleep. So we want a synergy, a full spectrum product that will help to reduce these symptoms. So this is a great slide that really shows the breast. It also shows how cannabis can help to reduce some of the symptoms that we see. In fact, we talked about how CBD and cannabis as a whole can reduce cancer cell growth. It can slow the growth of the tumor. It can control nausea. It can help promote an appetite. It can help control depression. It can reduce pain, especially neuropathy. See, nerve pain is typically seen in patients who have breast cancer because of the side effect from radiation. It can damage the nerve in those patients, and they can have horrible pain. It's called neuropathy. Cannabis, CBD, also reduces inflammation. We talked about how cancer cells are very, very inflammatory. It aids in sleep. It helps reduce anxiety. And what's so good about CBD is that CBD not only is not psychotropic, it doesn't give you a high, but it's not toxic as well. So these are some of the reasons why we can utilize CBD to not only address cancer treatments, but the overall symptoms that we see in patients with breast cancer. So how do these cannabinoids work? You know, when we talk about using CBD, consuming CBD, we need to understand how these cannabinoids work. CBD, CBN, CBG, Delta 8 THC, how do they work? Well, they work in the body by producing homeostasis or balance. When our body is out of balance, or when our body is deficient in very unique cannabinoids that our body makes, this deficiency can cause pain, it can cause discomfort, it can cause illness, and it can cause disease. So the way that cannabinoids work is through a science. It's through the most vital regulatory system in our body. It's called the human endocannabinoid system. Now, this system is a system that is a lock and key, meaning that the cannabinoids like CBD and THC and CBN and CBG and all of the other cannabinoids are the key. And the locks are the receptors. See, we have receptors in our body that are looking for cannabis and cannabinoids to put the body back in balance. And so on the very far right, you can see in this diagram that these receptors are found from our head to our toe. Every organ and gland has a way of modulating and regulating and controlling our balance or homeostasis when we consume CBD and other cannabinoids. So when we talk about how this works, it's through this science called the human endocannabinoid system. It's made up of receptors. The main receptors are CB1 and CB2. And when we consume these different cannabinoids, they will maintain balance in our body. They will reduce inflammation in the body. And they work on different pathways that, again, are found throughout our entire body, from our head to our toe. So CBD also can work on hormones. When we think about breast cancer, we think about some of these cancers are hormone sensitive. Some of these cancers are a result of hormones like estrogen, androgen hormones, male hormones like testosterone being out of balance, being too high. So on the very far right, you can see how CBD not only works on those receptors that modulate and regulate hormones, but they also work on different pathways that modulate mood, like serotonin, like adenosine, opioid receptors that are modulating and regulating pain. So hopefully you get where I'm going. And where I'm going is that this is science. It's not a magical potion. It's not a snake oil, but this is really science behind different pathways, different receptors, different ways of putting hormones back in balance to help those who have breast cancer, helping them with their symptoms. Again, we can't make claims that this is going to cure your breast cancer, but the science is, you can even see here how CBD and THC, when it's coming from a plant, it's a phytocannabinoid, when it's coming from a plant, how it affects tumors. It reduces the proliferation. It increases the cell death. It helps to reduce the inflammation, helps to improve the blood flow. And then the psychotropic effects, meaning that the THC part and even the CBD part help to reduce nausea, helps to reduce anorexia. That means that that person doesn't have an appetite, so they're losing a lot of weight. It helps to reduce neuropathic pain, right? We talked about how these treatments that many patients who have breast cancer, they get chemotherapy, they get radiation. Specifically, radiation damages nerves. And when those nerves are damaged, it causes a neuropathy, which is a debilitating pain that we can help those patients with. So this part is just to remind you that if you are speaking to a healthcare professional, or even if you want a healthcare professional to hear this information, that there's a lot of data out there that really shows the research and the science that is ongoing on how CBD is a promising anti-cancer drug, right? We can't make those claims, but just know that the research and using CBD and looking how CBD can start to reduce the proliferation, the tumor growth, the volume has been studied and is being studied currently. Again, this is more science that talks about how CBD can be used as a complementary therapy. I like that word. I like complementary therapy, and helping to stimulate the appetite, can help with pain relief, and can help with nausea as well. There was a study in 2015 that found that those who used cannabis or cannabis-based products had a 45% lower risk of even developing some other cancers like bladder cancer. So just know that CBD's role in a therapeutic role in reducing cancer cells and cancer metastasis has been ongoing. Again, these are more studies in 2011, 14, and 17. And remember, these studies were done prior to the 2018 Farm Bill. These are studies that have been done on mice and piglets, because the 2018 Farm Bill that now allows CBD to be used in research is really going to help really evolve CBD as being a therapeutic option for breast cancer. But there are many, many studies that have been done prior to the 2018 Farm Bill. Another question I get a lot is CBD safe to recommend to those who are getting chemotherapy currently, right? And the answer is yes, yes, and yes. CBD being used during treatments will help to reduce those side effects like nausea and vomiting, helping to stimulate the appetite. But again, when you're recommending CBD and someone is actively going through radiation and chemotherapy, remember to recommend that that person speak to their healthcare professional. Healthcare professionals, yes, they need to know when a patient is using an alternative, an herbal remedy, and CBD as well, so that they understand that there is something else that is in addition to their treatment, which is chemotherapy or radiation. So yes, they can use it. In fact, these studies show that CBD cannabis products absolutely was shown in studies with mice to substantially kill cancer cells. So 74% of cancer patients are interested in learning more about how CBD and other cannabinoids can help. So just know you have a very unique position in patients who are looking for an option like CBD to add to their regimen as they are undergoing treatment. So just to remind you, there are ways to reduce your risk for cancer, breast cancer, keeping a healthy weight, exercising regularly, getting enough sleep, limiting your alcohol intake, and breastfeeding your babies. Well, breastfeeding your babies, many of you on the line may be long gone from having babies or even breastfeeding a baby, but you may have a granddaughter or a grandniece that is in their reproductive age, and you want to educate them about CBD, and you also want to educate them that breastfeeding can lower their risk of breast cancer. And the reason why breastfeeding can lower your risk of breast cancer is typically when a woman is breastfeeding, she doesn't have a period, right? That's one of the things women love about breastfeeding, along with giving something healthy to their baby. But when they don't have a period, they don't have those high levels of estrogen. Again, that exposure to estrogen is a risk factor. Another thing, when you're breastfeeding, your breasts are making what? They're making milk. So it doesn't give the breast chance to have an alternative pathway, which could be a pathway to produce cancer cells. So those are the reasons why breast cancer lowers your risk of breastfeeding, lowers your risk of breast cancer. One, you're not having periods, you don't have that high level of estrogen, and two, your breast is really promoting milk and not having the chance to have a DNA mutation and can cause breast cancer. So let's look at some products. Let's look at some scenarios of when we would recommend our products here at Wakana for those who may be undergoing treatment, chemotherapy, or radiation for breast cancer. Again, I cannot stress this enough, that these products are not intended to diagnose, treat, cure, or prevent any disease, not just breast cancer, but any disease. If you are undergoing treatment for breast cancer, let your oncologist know that you want to use CBD, and you want to use CBD as a tool to address maybe nausea or vomiting, or maybe sleep, or maybe anxiety, or maybe depression, okay? And what's so great about CBD is that I have looked up many of the chemotherapies that are being used for different cancers, not just breast cancer, but brain cancer and colon cancer and prostate cancer, and CBD does not interact with any of those chemotherapies. So that's a good thing. But again, please let your physician know that you are wanting to use CBD. So how does CBD affect cancer-related symptoms? We're going to look at products that can help alleviate pain, because pain is a symptom. Increasing your appetite, because that is a symptom. Improve nausea and vomiting, because that is a symptom. reducing anxiety, that is a symptom, and improving sleep. Now, what you don't see on this slide is what? How CBD can cure your cancer. You do not see that on the slide. That's super, super important. I don't want to say it again, but I'm going to say it again. We can't make any claims that CBD would cure, prevent, diagnose any disease. So let's look at pain. When a person is undergoing chemotherapy treatment or has breast cancer that may have metastasized to the bone, we absolutely can recommend our Extreme Power Pain Cream, which is a salve. It's an amazing cream that is topical. It is a full spectrum product. It's a product that contains the legal limit of THC, which is 0.3% or less. It contains all of those other cannabinoids we talked about, like CBD and CBN and CBG, and it contains 6 to 8 essential oils that address and enhance the anti-inflammatory properties of CBD. So this is a topical pain cream that you're going to use throughout the day. You're going to use at night so that you can get a good night's rest and not have discomfort or pain. The next product is Dr. Rita's Rub. It is a liquid pain relief. It's in a roller ball. This is something they can carry with them throughout the day. They can use this in addition to the Extreme Pain Cream. And then the last one is our smokable. Why I love putting the smokable, either the pre-roll or our cartridges in the mix, is because it works fast. Within 1 to 5 minutes of using a cartridge or one of our pre-rolls, you can get relief within 1 to 5 minutes. Now, what you should understand is that that product, when it's inhaled, typically will last in the bloodstream for only about an hour to an hour and a half. And so this is why we talk about using multiple products, so that within an hour after you've gotten relief, another product is kicking in and getting relief. So that's my recommendation for pain and discomfort, to really treat and assist those symptoms. Nausea and vomiting is another issue. We want to address nausea and vomiting so that CBD in a tincture form, putting it under the tongue and just letting it absorb under the tongue for about 60 seconds before you swallow. This is a great option because tinctures last in your body for about 6 to 8 hours. So you want a product that's going to be around longer than that smokable, which is only about an hour, that will give you relief for nausea and vomiting. Now, what I love about our product line is that we have 2 different product lines. We have a Power, which is a full spectrum line, and we have a Pure, which is a broad spectrum line. What is the difference? Well, the broad spectrum has less than 0.0% or less of THC. And it's great, that Pure line, that broad spectrum line, that bottle with the white label, that's a great product for those who have random drug screens at their job. If you don't have random drug screens, then the full spectrum or the Power line is a great option for you. When you introduce CBD to the body, it's important to start low and start slow. When we look at studies, the Mayo Clinic, these big research institutions have found that you don't need a lot of CBD. More is not better. So starting low means 3 drops under the tongue twice a day. Again, some people need 15 drops twice a day, and some people only need 3 drops twice a day. It really depends on your metabolism. It depends on your diet. It depends on your body chemistry, and it depends on the severity of your issues and the potency of the product. Now, here at Wakana, we offer a more therapeutic grade product. It's called Hemp Md, and we use that For those more challenging conditions, it's 900 milligrams of CBD in a 15 ml bottle. This Power Hempranium is 500 milligrams of CBD in this 15 ml bottle. And then our Pure is 300 milligrams in that 15 ml bottle. So when we talk about milligrams or when we talk about dosing, one drop is 1.67 milligrams, right? I don't want you to get that confused in thinking that one drop is 500 milligrams or one drop is 300 milligrams. No, that's the total amount of CBD in the entire bottle. But you can break it down and just know it's between 1 and 1.67 milligrams of CBD for each drop. Appetite. You want to stimulate someone's appetite that has cancer, hands down, Delta 8. Let me tell you why. Delta 8 is one of the new cannabinoids on the block, but Delta 8 mimics Delta 9. Delta 9 is the cannabinoid that is more abundant in marijuana, right? In the marijuana plant. But tonight we're talking about hemp. Because Delta 8 is so close to Delta 9, and Delta 9 gives you the munchies, I recommend anyone that is trying to improve or stimulate their appetite to use the Delta 8 gummies. Now we have two Delta 8 gummies. We have the 50 milligram and we have a 25 milligram. Again, I would start low and I would start slow. I would start with a 25 milligram gummy with half of a gummy or a quarter of a gummy if it's a 50 milligram Delta 8. So just know we have different dosing, we have different strengths. It depends on that person's severity. If they really are underweight, they're almost anorexic, right? Or they have more of a mild issue going on and they need just a little help with their appetite. These gummies are infused, they're not coated. Infused means that they're more potent because the Delta 8 is throughout the gummy and just not on top. But just know, start low, start slow. Fatigue. Fatigue is another symptom that those who are undergoing breast cancer treatment, like chemotherapy and radiation, they really suffer from a lot of fatigue. They're not sleeping well. There's a lot of stress and anxiety. So I recommend a good night's sleep. Now, a good night's sleep could be with our Power gummy. It could be with our broad spectrum gummy. It can even be with our Delta 8 gummy. But just know that these gummies take in about 30 to 90 minutes before you go to sleep. And I say 30 to 90 minutes because when you're consuming a gummy, it's got to go through your stomach, then process the liver, and then to your bloodstream. That gummy is going to take a longer time to get into the bloodstream than that smokable or that tincture. So take gummies about 30 to 60, maybe even 90 minutes before you have to go to bed so you can get that REM sleep, that restorative sleep, that sleep that helps to not only give you that restoration that you need in the morning with energy, but that sleep that helps to rebuild your immune system. Because at night, that's when your immune system resets and rebuilds itself. A stronger immune system does a lot better with those who are undergoing breast cancer treatments. I love peppermint. Peppermint is a natural energy essential oil. Now, I put peppermint on the soles of my feet. Why? Because the soles of our feet have the largest pores. So you're going to absorb that peppermint a lot faster and a lot more efficiently if you put it on the soles of your feet. You can also inhale it. You can use the palms of your hands as a diffuser. One spray in the palms of your hands, inhale that, will give you natural energy. See, we're talking about natural, holistic ways of improving fatigue. And drinking a Red Bull and all those other energy drinks is not the way to do it. Anxiety, depression, all of these feelings are going through those who have been diagnosed with breast cancer, going through those who are on treatments for breast cancer. Again, I recommend the smokable, because the smokables are going to address that anxiety within 1 to 5 minutes. And then, of course, the gummies can be taken throughout the day. They don't always have to be taken at night. I personally like using the broad spectrum gummies during the day, keeps me calm, keeps my anxiety level at bay. Now let's talk about hair loss, because hair loss is really a big thing, right? Most who undergo chemotherapy, not all, will lose their hair. These are the stages of hair growth: anagen, catagen, telogen, and then the shedding happens in late telogen, telogen stage. But when you receive chemotherapy, the chemotherapy hits that hair follicle in this stage. It hits it at the anagen. It's called anagen effluvium. Anagen effluvium is different from telogen effluvium. Telogen effluvium typically happens when you're taking medications for blood pressure, or you're taking medication for high cholesterol, or even diabetes. It can cause a temporary hair loss. That's called telogen effluvium. But when you're dealing with chemotherapy, that hair follicle is hit during the growth phase. It is hit during the anagen effluvium. Now, that hair follicle may not come back, but many times it does. So we have a product that addresses alopecia. It addresses it addresses let me get my slides back. They just disappeared. Give me 1 second. It addresses the anagen phase of hair loss. So let me show you some of our products here that we have to address that. That's our Empowered Hair, and that's also our SOS, Save Our Strands. Save Our Strands is a whole system that includes shampoo, it includes a conditioner, it includes a detangler, it includes a styling cream, along with our Empowered Hair, which can be used as a tincture, or it can be used topically if you have urine drug screens. So just know that these products, yes, can address the alopecia or the anagen effluvium. As long as the hair follicle is there, that hair will grow back. Another thing that we want to introduce is the use of our body creams. We have body creams that are infused with CBD and hibiscus and lotus that can be used during that lymphatic drainage massage. A lot of patients who have undergone a mastectomy or any lymph node dissection or removal because of breast cancer gets a lymphadenopathy or lymphedema. They have a lot of swelling in the arm. These are products can help to reduce the swelling. They can help to reduce inflammation during a massage. So this is a great product that for those men and women who go for regular massages can use, or maybe they can do their own massage at home and then use that sleeve for lymphatic drainage. Sexual health is impacted. It's impacted in those who have breast cancer, who are undergoing treatment for breast cancer because there is a reduction in estrogen, progesterone that causes vaginal atrophy. vaginal dryness. It causes a reduction in libido in both men and women. And so we have products like our CBD lube, our products like our KOJ, our King of the Jungle gummies, and then again, our sensual body creams that can be used to address a better, healthier sex life. So right now I'm going to take some questions. I'm sure you have questions about breast cancer. We're going to take questions only tonight about breast cancer and the use of our products in addressing those symptoms like nausea and vomiting, like stimulating the appetite, helping to reduce pain, helping with sleep, anxiety, and depression, and again, addressing sexual health and lymphadenopathy in those patients. If you have further questions, maybe you have to hop on the line, hop off of the webinar, please email me. I'm open to emails all the time. My email is ritamd@wakana.com. Again, that's ritamd@wakana.com. Now, tonight, I'm only taking questions in the chat as it relates to breast cancer and different symptoms that those that you love or may know that have breast cancer. If you have any other questions, I'm not going to address it tonight. You can email me if you have other questions. So let's look in the chat box and see what's going on here. Let's see. There's a question about, do health insurance companies, have they started to cover CBD? So what I have found is that there are some insurance companies that are during their spin down time. If you have a recommendation from your physician, if your physician puts in writing that you would benefit from CBD, I have seen that some of those spin downs, some of those insurance companies will cover the payment. Traditional insurance companies like Blue Cross Blue Shield, Cigna, a lot of those bigger companies I've not seen do that, but some of the smaller companies have. And we're hoping each and every year as CBD becomes more mainstream, we're going to see more of that. Hopefully we're going to see more physicians that are going to be open to recommending CBD to their patients. So a lot of changes are rapidly being made, but we're hoping that this will become mainstream. It will be just like a physician recommending a multivitamin, right, to you for your overall health and wellness. It says, with the acknowledgement of Delta-9 THC, does Delta-8 have CBG, which becomes THC? So Delta-8 is a very, very close cousin of Delta-9. In fact, Delta-8 and Delta-9 differ by a carbon. So Delta-8 and Delta-9 are very different than CBG. CBG, it is not a constituent that converts to CBG. So no, Delta-8 and Delta-9 are very close. That's why those who like Delta-9 love Delta-8, because it gives them that same sort of feeling. What sort of feeling is that? Well, Delta-8 gives you that feeling of creativity. It gives you that feeling of focus. It is a more potent, effective cannabinoid on those who have seen very little relief from CBD. So it is more of a body sort of stimulating feeling. And for the mind, it's not a high, it's not a euphoria, it's more of a focus and one of creativity. That's why millennials love Delta-8, because it gives them the opportunity to have less anxiety, less stress, and more creativity. Are these breast cancer risks for men as well? Yes. Outside of breastfeeding, men don't breastfeed, obviously. But for men, yes, reducing alcohol consumption, reducing weight, uh, making sure that your diet is not a diet of processed food, but plant-based. Yes, men need to get their vitamin D level checked because maybe you have a vitamin D deficiency. You want to replace that vitamin D. And men are constipated too. So just like those risk factors for women and having not very frequent elimination, men need to increase their fiber as well. So that's a good question. Yes, men and women still have the same risk factors outside of breastfeeding. Men don't breastfeed. Delta 8 is loved by baby boomers as well. Very good. Someone, Magnolia, but higher death rates from cancer in African American women. Maybe that's a statement and not a question. But yes, African American women typically, because there is in many communities that are disenfranchised and marginalized, access to medical care is limited, and many women of color, Black and brown communities get to their mammograms later. They're not doing self breast examination. You know, that education really needs to be continued in our community. Any other questions? If you are a guest on the line, we absolutely want you to connect with the person that invited you. We want you to get this information out to all of those that you know are breast cancer survivors. Breast cancer survivors, a lot of the ones that I know are suffering from what we call that lymphedema, that lymphadenopathy that occurs after having had either surgery, manipulation of the lymph nodes and glands, and or radiation. So that's something that's real. In fact, there is a guest that we're going to bring on in the spring who is a physician who was diagnosed with breast cancer about 5 years ago. And because of the lymphadenopathy, she had to she had to leave medicine because she is now unable to work with her hands because of the lymphadenopathy. So she has promised to come on in the spring because she travels the world educating about breast cancer and just this one side effect, which is lymphadenopathy. So you want to make sure that this information is given to every single person that you know that's a breast cancer survivor, or maybe someone that has recently been diagnosed with breast cancer. This recording will be on our Facebook page. I am on Facebook Live right now, so if you go to my page, you can tag people to this presentation as well. Let's see if there's any other questions, just comments. I am so grateful that, you know, we have this platform to use to help those who've never heard about CBD to now be open to using CBD as a tool in their toolbox to address symptoms that many that have breast cancer have because of their treatments: nausea, vomiting, appetite issues, pain, discomfort, anxiety, depression. This is just a great opportunity to expose those with this information. So this is it for tonight. It's 9:02. Again, I'm on Facebook Live, so you can just hop on my page and tag those that you love. It will also be a recording that will be on our Wakana Facebook page as well. Be well, be safe. Good night. Again, my email is ritamd@wakana.com. Any questions, any critiques, Anything that you need to ask me, you want to email me at ritamd@wakana.com. Have an amazing rest of your night. We will see you next week, 8 o'clock on Wednesday. Be well. Good night, everyone.